Hello and thank you for joining me in this Mind Mastery video. We all have different ways of coping with stress, with anxiety, and some of these ways can be quite maladaptive and prevent us from dealing with the problem directly, or they can be maladaptive in a way that reinforce our anxiety further and, prevent us from learning how to adapt to new circumstances. Other styles of coping with stress and anxiety can be obviously quite adaptive because they are based on, for example, being focused on the problem and actively trying to resolve something that brings us stress, something that provokes in us this anxiety. However, it would be worth to also inquire into where does actually our anxiety or stress come from? And for some time now, I've been investigating an area, quite recent area in psychology called Schema Therapy, which is basically a combination of psychoanalysis with cognitive behavioral therapy. Now, Schema Therapy states that we all have various schemas that drive our lives. Some people are affected by these schemas to a large extent, which might impair their functioning to a large extent. Other people might not be so affected by them, despite having all the schemas in place. Now, schemas are not entirely new idea in psychology, and they don't belong just to their area of psychology, but actually kind of have been confirmed by neuroscience. And we use schemas on a regular basis, which could be also described as simply mental shortcuts, something that helps us to understand the world around us quicker, so we don't have to learn how the world operates over and over again. But if we have a repeated experience of something, we simply learn how to interpret it very quickly. And obviously that's very efficient in most of the situations, because we don't have to spend 10 minutes on learning something, but we simply know what it is. So you have this sort of pattern of your behavior, your feelings, and beliefs. Now, that's in general. Now, when it comes to schema therapy, this theory is a little bit more precise because it deals with schemas developed through negative experiences. So, for example, there might be a schema of abandonment or a schema of defectiveness. So, with the schema of defectiveness, you might have this underlying belief that you are not good enough, you're simply not competent enough because, I don't know, maybe your parents weren't supportive enough, maybe your peers bullied you, maybe you couldn't cope with the demands at school and you didn't receive the support that you needed. So you started believing that you are defective in some ways. Now, the reason why it develops into a schema is because there were certain situations in your past, certain experiences that you engaged in that had a particular tone to them. And there were certain similar elements to each of these experiences. For example, your father wasn't supportive enough, and maybe he was even quite abusive towards you, and verbally, maybe he didn't appreciate you, and so on and so forth. So, this sort of situations, they develop into a schema by simply an association. So, as an adult, you might hear a person saying a similar thing that your father said in the past, or your peers at school said in the past, and that triggers your schema, and you believe that it's precisely the same experience as in the past. Obviously, it's happening all unconsciously. If it was all conscious, then it wouldn't be as complicated, and I wouldn't need to talk about it in the first place. But because it happens unconsciously, you don't realize that you repeat the same pattern again. So, when that person says a similar thing that your parents said in the past, you start to associate this situation with this past experience, and as a result, you're gonna experience similar feelings, similar emotions, similar reactions to what happened, and you're gonna try to cope with this situation in the same manner as you did as a child or when you were younger. These schemas are not necessarily just associated with mental health disorders, such as, personality disorders or anxiety disorders, but they can have effect on every single individual, because it's quite difficult, maybe even impossible, to have just positive experiences in the past. And we all have these different weaknesses, these different soft spots that can influence our behavior to some extent. Now, if you watched my previous video on integrating the shadow, this idea is quite similar, because we usually kind of banish this or repress these weaknesses into our unconscious, so we don't have to deal with it. And as a result of this schemas are going to influence our behavior and might often impair our functioning and reduce our life satisfaction. I will be covering the subject of schemas in other videos, because it's quite a lengthy subject and I really want to spend some time on explaining the theory behind each specific schema. And for this video, I'd like to focus on specific coping styles that we usually adopt, which can help us to deal with our weaknesses or with our soft points, as I like to call them. Jeffrey Young, who was actually behind developing the schema therapy, theorized that we deal in 3 distinct ways with situations that we perceive as threatening, because they trigger our unconscious schemas. So in other words, we simply see certain things as threatening because they trigger our weaknesses, they trigger our schemas, and because we are unconscious of this process, we usually develop, lengthy theories as to why we don't want to do certain things, why we don't like certain people, why we want to avoid going to certain places, and so on and forth. So he identified 3 coping styles, which are avoidance, overcompensation, and surrender. Now, avoidance is obviously based on avoiding triggers or avoiding threatening situations because they trigger our schemas. So we might simply, if we have a schema of defectiveness, we might avoid situations which, put us on the spot or require of us to be competent or to expose ourselves, because if we do it, our schema will be activated and we're going to start experiencing various symptoms such as anxiety or really intense fear or anger. And because our primary style is to avoid it, we're going to try to escape the situation as quickly as possible. And in the future, we'll do everything in our power to avoid this sort of situations. Now, the second style is based on overcompensation. Overcompensation in this context means that we'll do everything to kind of overpower our schema. So imagine someone who has a schema of, emotional deprivation, which is based on feeling not being understood, not being seen by others, which is being triggered in situations requiring, for example, intimacy or simply building relationships with other people. Now, someone with overcompensating coping style will do everything to, for example, be very independent. And they will try to prove to other people that they don't need them. And doing this, kind of engaging in these behaviors that aim to minimize the effect of the schema, is quite maladaptive, because such individual will not be able to actually heal their schema. And they don't really realize that whether they like it or not, they are still controlled by that schema. But because they are using this overcompensation, they might feel like, they have this power to control their anxiety and kind of avoid feeling vulnerable in certain situations. Now, the third possible coping style is based on surrender. So in such a situation, an individual surrenders to their schema. If they have the schema of defectiveness, they accept it. That's it. They are defective. And obviously it's gonna destroy their self-esteem entirely, right? In other case, someone with emotional deprivation, they're just gonna surrender to the fact that nobody understands them, they can't find fulfilling relationships, they can't connect with other people, it's entirely pointless. And even if they consciously start looking for relationships, they're gonna engage in this something called repetition compulsion, and they will seek for partners who reinforce the schema of emotional deprivation. So, for example, these partners might be very distant or very cold, very aloof, which reinforces this original emotional deprivation schema. Now, there are actually 16 schemas, if I remember right, so that's quite a lot to discuss, and I was planning to break it down into several videos so I can spend some time on explaining the whole theory behind each individual schema. Now, the coping styles are actually these general tendencies that we can use, which can help us to deal with stress, to deal with anxiety, but they can become very maladaptive if we overuse it. So someone who, for example, just uses the avoidant coping style, that they're gonna avoid certain experiences that could help them to grow. So coping styles, in a way, can be adaptive if we can be flexible enough to use them accordingly to each situation. Now, for example, sometimes we just don't want to deal with our problems within this particular day. We might feel very tired, or we might feel overwhelmed, but the next day we are able to engage in this active problem solving. Other times we might feel like we have to put a little bit more energy in order to compensate for, underlying weaknesses, which also might be fine to some extent. I mean, it's very difficult to kind of find this spot between healthy coping style and unhealthy coping style, but generally the whole idea is that healthy coping is based on this flexibility and the ability to adapt to different circumstances, to be able to cope with different situations that we find ourselves in by using all this different coping style. Now, the moment we fixate just on certain coping style, that's when it can become quite maladaptive. So generally, all these three coping styles are present in each individual, but each person obviously has different schemas, has different learned behaviors that can help them to kind of cope with what they perceive as threatening or their insecurities. So furthermore, we can say that the coping styles break down into various coping behaviors which are very specific to each individual. So that's a short introduction to schema therapy, and I've briefly explained how we use different coping strategies, coping styles, to deal with these underlying schemas. In future videos, I'm planning to kind of dive into each individual schema and explain where they're coming from and what we can do in order to minimize the effect on our everyday life. Thank you very much for watching. See you next time.